Welcome to another episode of MedTalk. We bring various experts to discuss current and important topics to benefit our audience. This is our 11th episode during the current public health crisis and pandemic. We have three distinguished guests today with us to discuss very sensitive but important topic of suicide. So let me give you a brief introduction of our guest today. Our first guest is Dr. Vasudev Makhija, who is a psychiatrist in Central Jersey and is a distinguished life fellow of the American Psychiatric Association and is the founder and president of SAMIN, a non-profit organization devoted to addressing the mental health issues of the South Asians in the US. And he is also the past president of New Jersey Psychiatric Association. Our next guest is Dr. Upadhyay, who is a board-certified adult, child, and adolescent psychiatrist, presently serving as the president of the New Jersey Psychiatric Association Central Chapter. She is also an associate professor at Rutgers, the RWJ Medical School. She is passionate about mental health and fighting the stigma associated with mental illness in our community. And our last guest is Vidisha Mulani, who is a clinical research professional in graduate school at NYU and studying public health followed by nursing. Her goal is to be a nurse with a background in clinical research and public health. As a suicide survivor herself, she hopes that her experience will enable others to be more aware of suicide and its prevention, as this can affect anybody from any walks of life or background. Welcome Dr. Makhija, Dr. Upadhyay, and Vidisha to MedTalk. We are here today to discuss about suicide risk and suicide in our community. So I'm going to start the question to Dr. Upadhyay. Welcome, Dr. Upadhyay.
Thank you, Dr. Patel, for having me over.
So since we're talking about suicide, many misunderstanding and misbelief about suicide in South Asians. Can you tell how common suicide in youth compared to adults in overall and especially in South Asians?
Okay. Suicide, as you know, has become a major problem. It's become a crisis. In fact, it's becoming a public health problem. Not just in the Asian community, but in the other communities, not just in children, but even in adults. I am a child and adolescent psychiatrist, so I will focus more on youth and early adults. That means I would be covering people that are under the age of 25. The adolescents would be from the age of 13 up until 19, and from 19 to 25 would be the early adults. As you've said that, suicide is a burning problem in our community and a lot is not known about it. It is so much prevalent that it has become the second most important cause of death in young adults from the age of 15 to 25. And the third important cause of death in children from the age of 10 to 14. So you can imagine the magnitude that it has become second and the third cause of death of young people in our community. So there's a lot to be explored, a lot to be talked about, and still there is a lot of stigma attached to suicide. And I'm so grateful to you, Dr. Patel, for having us over today to discuss on this forum about the most prevalent problems of suicide. Thank you.
Thank you so much, Dr. Upadhyay. So, Dr. Makhija, I have a question for you. Is it true that if someone is really suicidal, they are probably going to kill themselves no matter what you do?
Okay, I'm glad you asked that question because this is a very common misconception in people. In fact, I've even heard this from experienced physicians, and then they view this with a very fatalistic attitude that, there's no point in doing anything. And such thinking can only inhibit or discourage proper steps that can prevent suicide. The fact is that suicide is preventable. 80% of people that die by suicide have given some indication or warning. In fact, 45% of people who die by suicide have seen their primary care within a month prior to the death. And if you take the older adults, 58% of them would have seen the primary care physician prior to their death by suicide. So most people who are suicidal, it's for short periods of crisis. And another point is that most suicidal patients have mixed feelings. So part of them, and that crisis, wants to die, but a big part of them wants to live. And that would explain why many of them who attempt suicide, for example, by taking an overdose, will then pick up the phone and call a loved one, a friend or a girlfriend or a spouse or somebody, because they really want to live.
Yes.
They don't want to die. So helping someone through a suicidal crisis can save a life.
Sure. So follow-up question on that. So people say that asking a depressed individual about suicide may put that individual at risk because they'll start thinking of suicide. Is that a true or is that a myth?
Actually, this is simply not true. Often the suicidal person is relieved when asked about suicide thoughts. Asking about suicide does not amount to suggesting suicide or increasing the likelihood of suicide. In fact, when you ask someone about suicide, it can invite a discussion, a dialogue, and the person will actually feel relieved rather than feeling intruded upon. So the risk is actually not asking when you need to ask.
Yeah. So that's a good explanation, Dr. Makhija. So a question for you, Dr. Upadhyay. What are some of the possible factors contributed to youth suicide, especially the rise in the rates of youth suicide happening in this country and across the world? A lot of young people taking their lives because a lot of factors come into play. What can you explain to our audience about that?
That's a very good question, Dr. Patel. No two youth, no two adolescents, and no two children are alike, but there are certain commonalities that they have to themselves. It has been seen that youth, adolescents that have contemplated suicide or have completed suicide have certain factors that are common to them. For example, a dysfunctional family. Loss of connectedness with school, feeling hopeless, feeling lonely, indulging in substance abuse, or having an untreated, undiagnosed mental illness. There may be a family history of mental illness, a family history of suicide. Especially male youth are more prone to causing suicide, to attempting and completing suicide. I would say females attempt, males complete suicide. Also, a lot of children or youth feel disconnected to the support in the community, which would drive them to suicide when they have, like Dr. Makhija said, that they have put out feelers out there for help and nobody has been there for them.
So, Dr. Upadhyay, is there any correlation? So, some risk factors such as depression and some isolation and some mental health conditions. But besides that, any relationship between suicide and other factors such as bullying? Is that possible? Is that common in suicidal individuals?
That is a very prevalent question, especially in youth in our community these days. First, before we go on to that, let me talk a little bit about bullying so we understand what exactly bullying is about. Bullying is defined as an aggressive and a harmful behavior that happens between peers. So this is an act that is repeated and it happens over a long period of time. So something that happens within days or weeks is not bullying. Bullying would be something that happens over an extended period of time, let's say months, or maybe even years. Whenever there is bullying, there is an imbalance of power. It may be in the form of physical power, or it may be a game of popularity. And you know that as children are growing, as adolescents are growing and becoming independent and finding their own individualities, peer relationships are very, very important. And that's why bullying is very important for us to be discussing today. And thank you for bringing that issue up. The research says that whenever anybody is bullied, that means they are victim, or the perpetrators, that those are the bullies. Both of them have something in common. They have been exposed to some kind of an abuse. The abuse can be of any form. So they are also in later on in life prone to mental health problems, substance abuse, loneliness. So they have a lot in common. So it's not just the victim that suffers. There is also the bully who's causing the bullying is suffering, and the act of bullying from that perpetrator is coming because there is an unresolved issue within them. So when you look at the research, bullying per se is not directly related to suicide, but bullying, if combined with other risk factors like depression, anxiety, helplessness, hopelessness, loneliness, lack of support, substance abuse, that would then lead a child or a youth to suicide.
Thank you for that wonderful explanation. So, can you tell our audience what is the relationship between social media? Because social media is huge nowadays. Everybody is on Facebook, Twitter, and Instagram, and many other social media platforms, and they spend a lot of time and they have a lot of influence from those platforms. Is there any relationship between the social media and suicide itself?
Yeah, social media, when it came up, it became a sensation. You know, just at the click, we could reach anywhere and the geographical boundaries were broken. So social media can be good and social media can be bad. Now, let me talk about the bad aspect of it. When children are on the social media for, let's say, 5 hours or more, then they are alienating themselves from their social supports and they are becoming more and more lonely because they are more invested in just being connected virtually, which will then lead to loneliness. Loneliness leads to depression and so forth. There is a downward spiral. Also, just with the click of a button, there is so much wrong information, or I would say unwanted information, that is available, and not just from the community where you are, it would be available anywhere. And let's say if a youth is feeling a certain way and they put that word in, there will be so many hits. And the youth is likely to go and navigate and see and a lot of times identify with what is going on. So I would say that monitoring of social media is a must. On the other hand, the social media is a great resource. Click of the button, you know what exactly is, what help is available, not just where in the town that you live, but you can even help somebody who lives far away. It helps you recognize mental health. It gives you a very precise definition, symptoms. There's a lot of support forums that are available, even if you cannot visit a doctor or a therapist for whatever reasons. There is a lot of support available. So I do not see, and I have looked at various research, social media per se is not directly related to suicide. But risk factors like loneliness, depression, like I mentioned, substance abuse, abuse of any kind, when coupled with the misuse of the social media, would increase the risk of suicide. But I also have to balance it out by saying that social media in its own way, if used productively and in a very responsible way, can actually help suicide, because click of the button, you can get help. If somebody is feeling suicidal and there is nobody around, just by the click of button, there is so much help available.
Sure, sure. So, is there the warning signs? Is there any difference between the suicide warning signs in the youth versus adults or grown-ups, or those all are the same?
Yeah, I have to say that depression is one of the major risk factors of suicide. So children that are undergoing a lot of stress may not present as depressed. They may be irritable, angry. You may see a lot of acting out behaviors like, being oppositional, getting physically aggressive, becoming sexually aggressive. They may start withdrawing. They may stop taking care of themselves. Their grades may begin to fall. Their interactions between their families start to dwindle, and their interaction with peers also become much less. They become very hopeless. They don't see a sense in future. They do not talk about a future-oriented, vision. They want to give away things that are very, that are very close to them. So these are all warning signs that make a child or a young adult different from a normal adult.
So before we move on with the suicide in the youth, I have a question for you, Dr. Makhija. Is it true that if you stop someone from killing themselves one way, they'll find another way to kill themselves? Uh, any truth to that?
No, there isn't actually. Reducing suicidal persons' access to lethal means is a very effective suicide prevention strategy that has been shown in this country and many other countries. I'll give you two examples. One is if you take away the access to firearms, guns, it reduces suicide risk. Over 50% of suicides in this country, in men in this country, are by firearms. And with firearm, there is no second chance. It's like a finality of it. In countries where, in fact, in this country, in states where the gun ownership is high, the suicide rates are higher. And in countries where they have passed laws which restrict gun ownership, they saw the suicide rates drop in their countries. And so, as I mentioned earlier, suicide crises last for a short time. And without access to means, the critical time of the crisis will pass and the person's rational thinking might return, they will reach out for help. Another example I give is about when somebody suicidally jump off a bridge to die. In fact, there are some bridges that have notorious names of being called suicide bridges. In this country, we have the Golden Gate Bridge in California, and Canada has its own bridge, and many other countries have other bridges that are high. And we know that when the barricades are put up, the suicide rate drops. And they have done that successfully with the Golden Gate Bridge, and on the East Coast in New York with the George Washington Bridge. And I think they also considered an Verrazano Bridge, but I think they were not able to do it because of the logistics with the wind factor and all. But I'm hoping that they'll do that because one of my friend's husband actually jumped from Verrazano Bridge and died.
Yes. So follow-up question on that, Dr. Makhija. So I am in public health for the last 3 decades, and we teach adult psychiatry, adult mental health. Suicide is a very, very sensitive subject, and time to time we come across that some people threaten suicide to seek attention. Should those kind of threats be taken seriously? This is a debate all along. What can you say to our audience about that?
You know, it is said that those who are considered hypochondriacs eventually do develop some diseases, and they do die from some real disease, not from hypochondriasis. So just because we think that the person is threatening suicide for attention or whatever we think, does not mean we should be complacent. Those who talk about suicide or express thoughts about death, about wanting to die, are at risk for suicide and need your attention. And 80% of those who die by suicide give some indication, as I mentioned earlier. So the advice of experts in this field is take all threats seriously. And if you think they are just crying for help, so it's a cry for help, so help.
Dr. Patel, I would just like to add here, somebody who is perceived as seeking attention and using suicidal threats as a way of seeking attention obviously has some underlying pathology. So they should not be ignored. The attention should be given to them to explore where are they hurting, what is it that they need help with. And definitely there will be an underlying cause of their behavior. So it should not be ignored.
Yes, go ahead, Doctor.
That's a great point, Dr. Upadhyay. I'm glad you mentioned that. In fact, some of the experts, you know, we used to call such cases where somebody's threatening suicide or attention as suicide, and somebody who attempts actually is called suicide gesture. In fact, the experts say that we should not be using that. That is kind of minimizing the gravity of the problem and underlying pathology, as Dr. Upadhyay said. So the only two terms that they say that we should use when you describe suicide is person dying by suicide or suicide attempt.
Yes. So before we move into the help aspect of suicide, let's hear from Vidisha. Can you share your personal story of your loss? First of all, I'm so sorry to hear your loss, and it's a very sad story. But I think our audience, our viewers, need to understand your personal story.
Absolutely. Thank you, Dr. Patel, Dr. Upadhyay, and Dr. Makhija for being on the panel and giving me the chance to share my story. So, hi, I'm Vidisha, and I am currently a clinical research professional and a graduate student. Our family was like any other family, and we grew up with lots of love and support. My brother would often amuse us with his debates and with his music, and we were very normal to the outside world. And nobody would look at us and say that this is a family who has been through suicide, so to speak. And we really were a very normal and loving family growing up. So it was very something like suicide was, we never understood, we never thought that this would really happen to us. However, on August 27th, 2016, all that did come to an end. And my brother was Mohit, he was just 21, and he passed away to suicide while he was vacationing in Dubai. I was in New York at the time, and I was interviewing for a new job and in Mohit's apartment. And we all were under the impression that he would come back in September, go back to and maybe do research at NYU and then start med school. We were so blissfully unaware of what was happening to Mohit, why that he was even on any antidepressant medication or he was even seeing a psychiatrist. We never thought that suicide would happen. And we never thought that he would die of suicide on August 27, 2016, when he was very much so going to come back to New York September 2nd, 2016. And that moment when I heard about it was a very tragic one, very sudden one. And I could not process it. I couldn't understand that this would happen. And when I heard it at first, Mom had told me over Skype, and I thought it cannot be. He's going to come back and go to med school. There's no way that this can happen. But tomorrow never came, and it did happen. So in the months that followed, I started my new job, and I faced a lot of loneliness and alienation and sadness at the same time, trying to understand my brother's suicide. I was also young at the time, and I was in New York, so meeting new people was very difficult. Or, telling my coworkers when they would ask me if I had siblings, made it difficult for me to say that, no, I don't have a sibling. And naturally somebody will ask, what happened? And it was very hard for me to say that he died by suicide. However, in the months that followed, I slowly would seek out support from my brother's best friends, from my best friends, continued to be vulnerable to my feelings, and had a very open discussion with my parents. And that sort of support enabled me to feel more strong to survive suicide. And that led my mother and I to write our book, Saturday, the Sun Went Down, to write about Mohit's story, because for us, in our family, we were not aware at all that Mohit was going through depression, or that he even was on antidepressant medication, or that he even was seeing a psychiatrist. I studied pharmacy myself, and I couldn't see anything. To me, he just looked like a normal kid, maybe with a little bit of anxiety over studying, but nothing that screamed out depression to me. And we couldn't understand what was happening and why suicide happened to him. So we wrote our book in order to spread awareness that parents should be kept in the loop when children are going through depression. And recently we found out about the Samhin organization, and my mother and I are in New York right now, and we signed up for the Janani support group led by Samhin. In these few months that we have been part of the support group, it's been extremely helpful for us to have open conversations, to lead the dialogue about suicide, and to also feel supported that suicide loss doesn't just affect a specific person, or it doesn't just affect somebody who is very severely emotionally troubled. It can affect a very normal person too. And we felt supported knowing that we can come and talk about how difficult it is to understand depression and understand living with suicide and feel supported. So for me personally, having that support group has really made me very strong in understanding suicide, and in fact motivated me now to pursue nursing school next year so I can help other people who are going through this.
Wonderful. There was a very sad story, but very inspirational story. So it's almost 4 years for you, Vidisha. Can you tell our viewers, our audience, how you feeling now? How you are coping up with the loss you had? Are you back to normal in your life? Can you explain?
Absolutely. So there are times, time is definitely a big healer. Time heals, time helps me understand that, yes, it's been almost 4 years, and now I definitely feel more comfortable with being open about saying that, yes, this has happened to my family. And I've definitely felt a lot more in tune with my feelings. So I understand that there are good days and there are bad days. And if I do go through a bad day, I do end up thinking of coping mechanisms or thoughts that I can tell myself to think more positively that, yes, this has happened to us, but we are more than what has happened to us. And Mohit was more than what happened to him. The same can be said for anybody who has lost their family member to suicide or their loved one to suicide. They will say that their loved one was more than what happened to them. And we try to honor our loved one, each day that we live. So that has helped me stay a lot more positive in these last 4 years. Yeah.
Thank you for sharing that story. So let's come back to Dr. Upadhyay. Go ahead.
Dr. Patel, I do want to congratulate Vidisha for coming here and sharing her experience. I'm sure it has been very traumatic to relive what you just spoke, but thank you so much. Your experience is definitely going to be of great help to a lot of families that are struggling. And Dr. Patel, as we talk about our South Asian population, I have to mention that the mental health literacy is very, very limited in our cases. It's only 17% of the South Asian youth that actually seek help for mental problems. And out of the 17% that seek help, if they do complete their treatment, 80 to 90% do feel better. So as a part of the Samhin organization, and thank you, Vidisha, for speaking out, because there is help available. There is no stigma, there is no discrimination. We all have to come out. And just like Vidisha, we would hope more families would come together and talk more openly about it, because it is a problem that affects each one of us. When somebody dies by suicide, it's not just the family. It affects the whole milieu around. It's the community that you live in, the co-workers of the families. It affects just everybody. And just randomly reading a news on Yahoo about somebody that commits suicide, and you may not even know them, brings an intense feeling of sadness. we are all connected to each other, and this is a great loss, not just to the family or people around. It affects everybody. So it is time for us as the South Asian community, as we are progressing in other fields, we have to start looking into our mental well-being.
Go ahead.
Yeah, definitely. Thank you so much for bringing up that point, Dr. Upadhyay. I really like that you mentioned that. And something that made me also think about bringing awareness to the South Asian community is that as youth, we tend to push ourselves to succeed. And we define success as being something that our parents worked so hard towards. And as youth, we tend to internalize that and tell ourselves that we need to work 2 or 3 times harder than the average person because we are a minority and we're really trying to, crave or to build our path. And it's important to understand that as you want to build on your dreams and on your aspirations, like Mohit wanted to become a doctor, he got it. He was on his way to being accepted to med school. That in that time, it's important to not forget that you are still very capable. In spite of you working towards your dream, you are enough and you are worthy. And it's necessary to seek help when you need it, but to also keep your family and friends in the loop.
Dr. Makhija?
Yeah, I wanted to kind of echo on the 2 comments that were made. Every year we have now about, at least in 2018, I don't know what last year was, about 48,000 people in this country died by suicide. And each person that dies by suicide, at the minimum, has 6 survivors that are grieving. So let's say if a youth dies, there are 2 parents, a sibling, a couple of friends.
Yeah.
Not to mention all the other cousins and other things. Minimum of 6. So do the math, 48,000 times 6. And worldwide, I think every 40 seconds, I think there's a suicide.
Yeah.
Yes. And I think all good points, Vidisha, and both of you as a mental health provider, you know that through Indian Health Camp of New Jersey, we have collaboration with Samhain for last almost a decade to bring this mental health awareness in our community. And I think we need to focus our attention toward the youth now. It's the time to give this service to the most needy ones, because I think the seniors who are here, who are all in their last decade or last 2 decades of life, they may not think about suicide, but I think the youth is the one I think we need to focus. And I think Dr. Makhija and Dr. Upadhyay, we can discuss about this in our next year's plan and probably extend our services to youth for giving them mental health awareness and suicide support.
Dr. Patel, I would like to add that it is not just the youth. Like Vidisha mentioned, that parenting is very important. And as South Asians, our parenting is certainly different from, the Western world. Our expectations are very high. We believe in good grades, but we do not know the definition of good grades. Is 90 good? Is 80 good? Is 100 good? So we are never sure. And we put our children through that grind of just being exceptional, just being good. And the big we expect them to be good children always, which is something that nobody can define. That puts undue pressure on the children. So It is time for the parenting skills to be changed. Parents have to let their guards down and reach up to the level of the children and try and understand where these children are. Because these children are in a different world. They are in a Western world where they're trying to fit in with their peers in school, and at home they have a different identity. So they are struggling. So rather than just being authoritative parents, it is time for parents to come down to the level of the children and understand and be able to listen to them empathetically when children talk. A lot of times our South Asian parents are very quick to dismiss children and say, oh, that's so little, that'll happen, we went through this. No, when a child is speaking something, they need to be heard. And the least a parent can do is to provide an empathetic ear. There is nobody is asking them to problem solve or to give advice. Just being there and validating how the child is feeling will create that bond between the parent and the child, and will give the assurance to the child that no matter how I feel, I can always come back to my mom and my dad or whoever in the family, and I will feel supported. On the other hand, if they spoke about, let's say, these are young adults and, romantic relationships, etc.,
Yeah.
these are things that are very important to them. And let's say if a child or an adolescent went to the parents and they spoke about a broken romantic relationship, which may have been for a few days, to an adult, it may seem like, what is the big deal? But the pain of rejection, the pain of loss of a romantic partner, however short the duration of the relationship was, is very real to that child. That child needs support. That child needs validation. And that's why, as a child and adolescent psychiatrist, I always advocate for parents to extend their parenting skills. They are wonderful at providing, financial and materialistic things, but they have to be available emotionally.
Emotional support, yes, absolutely. Yes, yes, very well explained. Dr. Makhija?
I wanted to kind of add 2 points, one in response to your comments and one Dr. Upadhyay's. While I agree with you, I strongly agree with you that, we need to address the youth issues more aggressively in our community outreach events. There's no question about it. But I also don't want to minimize the fact that in those who are in their later decades of life, the suicide risk is there. In those individuals, it is the 10th leading cause of death. While in the youth, of course, it's, I think, second leading cause in the 10 to 24-year-olds. So the risk is there. So we need to address across the lifespan, of course, but we don't want to forget the youth. I think that is very important.
Yes.
So that is one point I wanted to make. And the other one I wanted to kind of echo off of Dr. Upadhyay's comment is, and this is based on, like, I have received emails and calls, some engage these calls when people are looking for help. And some of the youth, college students who are suffering from depression, they go to the parents, they say, I think I'm depressed, I think I need some help, I need therapy. And the parents minimize that and they discourage going for psychiatric treatment. Oh, that's not a big deal, it's growing pains, you'll get over it. So my message to all the listeners, the parents out there, take that seriously, support the youth, and help them seek the treatment when they are asking. You should be glad that they are doing that.
Yes,
So that's the point.
Wonderful, wonderful point, Dr. Makhija. So, Dr. Upadhyay, last question for you regarding the therapy. So, antidepressant medications for youth and adults, do they help in reducing the number of suicides? Is that beneficial for psychiatrists to prescribe those antidepressants to those category of patients?
Yes, that's a very good question, Dr. Patel. First of all, let me start with saying antidepressant medications are not happy pills. They do not make you happy right away when you take it. There have been studies in the past that, people spoke about antidepressant risk related to suicide. So then prescribers, held themselves from prescribing medications. And then it was seen that without antidepressant medications, the suicide rates went up. So, like I told you, that depression is a very major risk factor for suicide. Antidepressants help with the symptoms of depression. They help people feel better. So, and when you look at the completed suicide in youth, only 2% of those youth that completed suicide were taking medications, which is a very negligible number. So, antidepressants, they are helpful in the treatment of depression and anxiety, and depression being the major risk factors, needs to be treated if we want to, work towards reducing the risk factors of suicide. At the same time, when antidepressants are being given, they should not be taken seriously. There are times when, when you take the medication, which takes a period of time, it doesn't happen right away in maybe a couple of days. It takes a few weeks, usually around 2 to 4 weeks. Around that time, the symptoms of depression start resolving. So there is a sense of well-being, a sense of wellness. And more likely than not, when people start feeling better, they stop medication. That is a risk where there is untreated depression, which can lead to suicide. Also, this is the time when the person who was very depressed and they didn't have energy, this is the time they're feeling a little bit better. So now the depression is not fully treated, but they have more energy. So they are more likely to commit suicide or contemplate suicide. So antidepressants are helpful, but education about taking antidepressants is very helpful. Also, continuing treatment and involving not just the patient, but the family in the completion of the treatment for depression is very, very important. Whenever any medication is taken, we weigh the risks and we weigh the benefits. So antidepressants are used when the benefits outweigh the risk. So people that are severely depressed are more likely to contemplate suicide. Those are the people that will benefit from depression if they are monitored very closely and they get the support that they need.
Dr. Makhija?
There are times when giving antidepressants could potentially increase suicide risk. And that is not the direct cause of the suicide, but it can cause certain side effects. Most significant is severe anxiety or restlessness and uneasiness. And that could contribute to more suicide risk. So the thing is that you don't give somebody a prescription for suicide and say, okay, I'll see you in 3 months. As Dr. Upadhyay said, that during the initial period of treatment is the very important period of vulnerability. You need to monitor that person closely, see the person every week if necessary, or more often if needed. So you can't just write a prescription and forget about it for 3 months. So that is what will increase the suicide risk.
Thank you so much. So go ahead, Vidisha.
So in my case, after this happened in 2016, my mother and I, in September 2016, we went through a very stressful, very difficult process of recovering my brother's medical records. And it was only through looking at the medical records, which we got after months of trying, and really we had to go through a lot of paperwork to get it. Was only then we even knew or understood that he was on antidepressants or that he was even seeing a psychiatrist. Eventually, we found out that it had been 6 months since he had not seen his psychiatrist. That's one. And two was that he was on medication on and off. So it seemed as though there was a 10-month gap when he was not on medication. And we wanted to understand that why is it that when he was on a gap, when those medications were not given to him, when we were not even told that he was going through this. If a patient is at risk of suicide, at least the family needs to be informed about this.
Yes.
And the second thing that Mohit himself told us, that antidepressants are not working for me. He said, it's not working for me. I don't want this. So how do we address those concerns? Because just yesterday, actually, when 4th of July was happening and we were seeing an advertisement on TV, we saw an ad for an antidepressant, Brintellix, where they mentioned that there was definitely an increase in suicide risk when you take antidepressants, and there's specifically a risk for those who are under 25. Mohit was 19 when he was prescribed these medications.
Yeah, there is a black box warning for antidepressants. But again, like I said, you have to weigh the benefits and the risk, which is more important. And depression being a major factor for suicide needs to be treated. What is important is whenever treatment is done, the family, the support system has to be involved. What happens with children when they turn 18, they make their own decisions and they are, they have the right not to include their families. So that is when the families get alienated and they don't know what is going on. A successful and a competent psychiatrist or a mental health provider would be the one who would encourage the patient to involve the family and to seek their support in their wellness, and tell them that this is not their sole journey. It is a journey with the support of the family. And it's not just giving a prescription to a patient and getting it over with. It is also engaging the family to help understand and educate what the family, what the person is going through. So depression is not just about antidepressant pills. There's a lot more that goes into treatment of depression. Medicine is only one part of the treatment. Changing the negative thinking, the dark thinking also is very important, and there are different kinds of therapies. Educating the parents about, or the families about, different resources that are available, because a lot of families may not know what depression is, and they may feel as if they are responsible, or they may feel like they did something that caused the child. So there's a lot. When you say a child is depressed or a person is depressed, it's not just about them, it's about everybody around it. And a successful treatment would be when we encompass everybody in that treatment.
Thank you. Thank you. Yes.
Thank you.
Dr. Makhija, yes.
Yes, I just want to reinforce which Dr. Upadhyay said clearly, that depression is not a panacea. It's not an answer to all problems. And I think, and it's just one tool. And we should not minimize the role of psychotherapy that it plays, even though in our community, we don't consider psychotherapy very important, because we feel, ghar ki baat bahar nahi karni chahiye. We are taught to just, the private matters of the family should not be revealed to outside, and that interferes with the psychotherapeutic process. But psychotherapy is an important part of treatment. Other point I want to make is what Vidisha mentioned, that Mohit was taking antidepressant, and he told the family that
and anxiety,
and that it wasn't helping. And what I want to say is, when you prescribe antidepressant, I don't know the statistic, I think about 50% of the people don't get help by it. Okay, then you try something else, another antidepressant. And there is a category of severe depressions, which we call treatment refractory depressions, which don't respond easily. And in those, the psychiatrist has to be more creative about trying different strategies, different type of therapies, and different combinations of medications to help the depression.
Yes. So thank you so much, Dr. Upadhyay, Dr. Makhija, and Vidisha, for the wonderful talk. Any last 30 seconds take-home message for our viewers? Start with Dr. Makhija.
I just, wanted to tell, I have a message for those who are left behind, who have lost someone to suicide. And the most important thing I would say is that they should acknowledge that the losses occurred and how it has occurred. And don't try to explain the death by saying it was an accident or some other inaccurate explanation. People shy away from using the word suicide when talking about death. And when you keep pushing it under the rug, that delays your healing indefinitely, and expect that such acknowledgement will bring in a lot of pain emotionally. But I think you might break down and cry, but that's a necessary step towards healing. I think we need to remember that. Acknowledge and accept. And I think, but nice thing is that you should know that in the subsequent years, the pain will get better, and expect the, waves at anniversaries and things like that. So that's my last message.
Thank you. Dr. Upadhyay?
Yes, being a child and adolescent psychiatrist, I always talk about parenting skills. I would want all South Asian parents to be emotionally more receptive to their children. Just a gentle hug, or just spending time with them, being in the room, would make a lot of difference. Please go out there and talk to them at their level, because what they feel is very real to them, and it is time that you understand. I understand that how you grew up back home was very different, but this is a different world, and the challenges that the children are facing now are very different from the challenges that you had faced. So it is time for us to now come down to the level of our children and expect beyond the good children and the good grades, because we want children that are resilient and are doing well in all spheres, not just academically, but doing physically well and mentally well. And only then we will be able to churn out good, strong children in the future.
Thank you. Thank you so much for that departing message. How about Vidisha, you?
Thank you so much, Dr. Makhija and Dr. Upadhyay, for giving me the chance to share my story. And extremely well said points, Dr. Upadhyay and Dr. Makhija, for saying that family needs to be involved. And when you treat one person's depression, you treat the community as a whole. You don't just treat the individual. And thank you, Dr. Makhija, was saying that we do need to acknowledge depression. We do need to acknowledge suicide. And my ending message will be that labels don't define a person. Mohit might have been, in his wake of suicide, might have been labeled by the outside society as being depressed, being anxious, or just being somebody who died by suicide, but he is much more than his labels. And labels don't define us in any way. So I do want to end with that. Thank you.
Thank you so much, Vidisha, Dr. Upadhyay, Dr. Makhija, for this wonderful, very, very important topic and the sensitive topic to benefit our viewers. So on behalf of IndusTV, I would like to thank you all for your time and support for the mental health initiatives we continue to struggle with our population, and we'll continue to have a positive journey on this subject. And I wish you all the best in your service to our community. Thank you so much, all three of you.
And thank you,
Thank
Dr.
you.
Patel, and thank you to Indus TV for bringing this important issue to forefront.
Thank you all.